Hi.
Hi there.
Hello. You must be Joslyn?
Yes, I am. Hi, how are you?
Good, good. How are you? Is that Rob up there?
Yes, it is. Hey, Kirk, how are you doing?
Good, good. How are you? Thank you both. I'm relieved that technology has worked so far. I have both of you. That doesn't always happen.
Ah,
So
hi, Jocelyn. How are you?
Hello, how are you?
I'm well. Looking forward to hearing about what you do. Sounds awesome.
Same. I was like, wow, to find two of us in a similar world.
I know. Isn't it great? Well, go Colonels, right?
Right? Kirk, do you expect, the timing is kind of interesting. Are kids even thinking about careers in September?
yeah, they are. Let's see. I'm just trying to get the settings right here. Can you talk, Rob, real fast? I want to make sure it goes to whoever's talking.
Okay. My name's Rob. I'm talking real fast. Okay, cool.
Okay. So on y'all's end, is it showing up so that you're getting Rob big, Joslyn?
Well, I have it set on gallery right
Okay.
now, so, but if you switch it to speaker, it shows up, like, it shows
Okay.
up appropriately.
Okay. Let me see.
Yeah, I think it's working 100% here.
Okay. Good.
Yep. Yeah, it just switched over right for me too as well. It switched over to
Okay.
Rob when he started talking.
Yeah, actually, one thing that really hit us was the internships. We had a lot of trouble with that. They just shut down.
I'm sure.
But so far, we've had our seniors do a pretty good job of getting positions, and I think some of that is the center mafia and the center network and that kind of thing. So they're always out there looking, and um, that's an ongoing thing.
Yeah.
I'm going to go ahead. One thing I wanted to just make sure you guys were good to go on everything before I start letting people in. Do you have a preference on who would go first?
I'll defer to Jocelyn. I'm happy to, or I'm also happy to go first. Whatever you want to do, Jocelyn.
Doesn't really matter to me.
Well,
Um,
yeah.
Well, I think it might be kind of cool to get Jocelyn's maybe a little bit more of a macro perspective on the granting process and what she does, and then I can take more of a deep dive into individual stories.
Okay. Okay, I'll go with that. So what I'm going to do, I'm going to start letting the students in, and I think we had maybe 17 or 18 sign up. Just a heads up too, Rick Axtell said he was going to stop in, so.
Oh, good.
no pressure.
Well, one time I had a professor lurking. He was actually in the room because we usually do these live, and the person didn't know, and it was kind of cracking. Like it was like, my physics professor, Robert. And then I'm like, oh, Robert's here, Robert's here. So I'm sure you guys wouldn't say anything bad about Rick. But,
Rick's my hero. Rick's
okay.
my hero. He knows he's my hero. So.
Or as a joke, if you wanted to say, that Rick Axtell. God.
He ruined my life, basically. He set me down this path. He's the worst.
I just wanted you to be aware there could be a faculty member.
Yeah.
All my religion faculty are in Jurassic Park, so.
Okay.
Exactly. Rick's the only one left for me, so.
See.
So
I might shame him for teaching in person because I'm pretty pissed at him for doing that.
Oh, right. He's starting to retire. So I'll introduce you guys, and then we'll have Jocelyn kick it off. You each kind of give your background, social justice work, that kind of thing, and then we'll go to questions and answers at the end. And I may have to prompt them a little bit, but I think we have a pretty good group. And sorry if there's any glitches. This is the first one we've done virtually, so we'll do our best. Can you guys hear me? Everything's good?
Yeah, it's going to be fine. It's going to be great.
No worries.
All right. Here we go. Admit everybody. Let's see. Can you guys hear us okay, students that have come in? Okay, good. Here we go. It's always so quiet on Zoom. It's different from meetings in person, you know, that silence is.
There's no courtroom murmur.
Right. I think maybe that's it.
That's what we need.
Yeah.
All I can hear is my heart rate, and that's not good.
Need some background music
That's no good.
or something.
I can just see you guys staring at me. That's no good.
At all. Okay. Let's see. We'll get everybody in here and we'll get going.
Sure.
All right. Okay, let's get started. I think we're at 11:30. So first thing I wanted to do is say hello to everybody and welcome you to our virtual career chat on social justice. Please remember to mute yourself when you're not talking, and then when we get to the question and answer part, you would have to unmute yourself. So I think we have a pretty good group, so we want to make sure we don't have background chatter. We are pleased. There's Rick Axtell with his mask on, making his appearance. We are pleased and fortunate to have two distinguished and experienced center alumni from the social justice arena joining us. We have Dr. Robertson Nash, and he goes by Rob. And he is a nurse practitioner by trade, if I'm correct. Is that?
Yes.
Okay. Mm-hmm. And director of the Pathways program at Vanderbilt Comprehensive Care.
Yes.
And then we also have Ms. Joslyn Allen, and she is director of governmental grants and special projects at Boston Healthcare for the Homeless Program. They are each going to talk a little bit about their career path, their work in social justice, and then after that, we will open it up for you guys to ask them questions. And we decided that Joslyn would kick us off.
All right. So please let me know if you can't hear me, do gestures or make faces at me. Like I said, we don't have a good courtroom murmur, so this is interesting. I'm stuck here in silence.
You're sounding good here.
But thank you folks for joining us, especially in September when this might not be the forefront of your minds. So we appreciate this. This is fun to talk about. So I guess I'll do a little kind of quick background of kind of how I came to be this way. And since one of the people I blame for this is sort of in the room, looking at me over his mask, this will be really fun. So I think probably it's the same for a lot of you folks. You know, social justice and social issues were sort of always in my heart. They were sort of, that felt my calling, but I didn't really have a name for it or have structure around it. I'm class of 1999. And so, and during my time at Center, there wasn't a structure, a formal structure or a framework for that yet. And so for me, it was really more about getting sort of a broad coursework, right? And it was more about getting a broad education and having that lens more than about a specific degree. And one of the main people who sort of helped me with that lens and helped push me was Dr. Axtell, who's sitting there grinning at me over his mask. And you know, making sure again that was a broad coursework, right? It was about the exposure and the thinking and the methodologies. So it was about getting some sociology and some philosophy, some policy. I even took an economic development class, having no econ background. I begged my way into an upper level class by doing some promising to do some summer reading and saying, like, I really want to understand sort of the development process. I don't want to get into econ as, you know, as a trader or things like that. I really want to understand economic development and those sort of impacts on poverty. Beg my way into those classes, right? So it was really about thinking about the perspectives more broadly and how they impact justice. And then really, especially back then, the religion department was really what was thinking about this. So it was ethics, it was religion and violence, and it was poverty and homelessness. And that was sort of where I found sort of the sweet spot of understanding these issues, of understanding more deeply where I could maybe see myself impacting these issues and where I could get deeper into the work and the understanding. So for me, it was about sort of taking that broad perspective of classwork, but it was also about how I took my out of class time and participated in a variety of things to sort of understand the issues that were out there and sort of figure out what resonated for me. So I did some volunteering with Habitat, did some volunteering with, there was a program at the time that was doing some volunteering for working with girls in one of the elementary schools that were sort of identified as being at risk with whatever rubric they used at the time. Excuse me, worked with the local school for the deaf a little bit. And then one of my favorite and sort of most touching and important experiences for me was going to do some volunteer work in Louisville with some of the homeless programs and the goat walker, which, does that still even exist anymore, Dr. Axtell? It does?
It does, but not during this pandemic period.
Well, obviously, yeah. And so for those of you who aren't familiar, that was a monthly open mic coffee house situation where they were bringing in folks who were homeless in Louisville and giving folks an opportunity to celebrate their humanity, right? To do open mic, to be served coffee and tea and desserts and snacks, and to share their talents, whatever they are, and to have that moment of just being human and artists and people, and to be served, right? To have us come in and say, what can I get you, and clap for you, and do those things, and not have it be about anything else, right? Not about what are your needs, what are your deficits, and having that be that it was really just a moment for me, I think, really that sort of clarified where I wanted to be spending my time. And so I think through all of that, I felt like social work was the next best logical step for me. And social work school was where I wanted to go. So I went directly from Center to social work school for a master's degree. Now, looking back on that and knowing my history and knowing the field of social work, I wouldn't necessarily advise going straight to social work school from undergraduate programs. Social work programs then and now greatly prefer people who have experience in the field. It's one of the few programs I think that is that way. I think most other graduate programs, or a lot of other graduate programs, are sort of equal about people, or maybe are more equal, I don't know. But social work in particular, I know, really prefers real world experience and really prefers to see people have much more work experience before you come into graduate programs. And I think it matters. I don't think it's just about getting into the good schools, although you will also get into better schools. But I think that you personally will be better prepared. I was Phi Beta Kappa at Center. I was, top 15 graduate. I was very serious and dedicated to what I was doing. I did not get into the schools I wanted, I did not get into one of the top tier schools that I wanted to get into. And I also honestly, my maturity level wasn't there. And I was a mature student, but knowing that, looking back now, I think I would not advise going right to social work school. I think I would be a better social worker. I would have been a better social worker, and I would have done a better work. So that's just my, that's real experience. I think you'll get into a better program and you will benefit more, and your clients will benefit more if you do work first. So that's a real world experience that I think really matters. I think, being a 22-year-old and having this impact on people's lives raw really makes a difference. And I think starting at the bottom makes a difference. And sort of recognizing that with this kind of work is really important. So I'd strongly advise that if social work is something that calls to you. The other thing is, to me, social work is a very interesting field because there's sort of two very different pieces of it. So there's social work, which was what I understood, which is the social justice. It's about changing systems. It's about helping people navigate. It's about these issues that we care about. And then there's social work that is much more focused on therapy, that is much more blended and almost impossible to discern from psychiatry or mental health therapy or mental health clinicians. And so, also finding a program that, depending on what your calling is, finding a program that's really strong in the justice aspect versus a program that's focused on churning out clinicians. So I ended up in a program that was, that had 15 of us who were interested in the macro level policy and justice, and turned out 75 clinicians a year. And that's, again, that's really important if you're there that means they don't have the expertise. They don't really understand the issues, and they're not versed in the language the same, right? That's not their focus. So it's something to really think about. But that being said, during social work school, I was able to sort of find my people and find activists and find areas that I could participate in, and try to make changes where I could, right? And try to participate in activism and do internships that felt like they were helping me figure out where I wanted to be and what I wanted to do. So I was doing things like working at the Social Work Office of Research and Public Service, which was looking at much more macro level changes and doing reviews of this, like the state's policy for child protective services, right? Where they weren't, where they were reviewing how are we doing these things and what are we doing that we could be doing better, and how could we be improving, when we're overreacting or where we're removing children where we shouldn't be, or where we're missing cases, things like that, where it felt like, okay, this is more justice and policy work than than not. And this is where, this makes sense to me, but it's still not quite exactly what I want to be doing. But it was helping me sort of piece that together. From there, I was able to meet people. As one of the evaluations that I was doing in that job, in that internship, I was able to meet people who were part of a greater national evaluation that was doing work on family homelessness, which again came back to where my heart was. And that and making those key connections is another thing that you're gonna find are really important. I think making those people connections and meeting people and finding out who's doing the work that you want to do is going to make your career path make sense to you, and is going to make those jobs come through. And so I was able to meet people who I felt impressed me and were doing the work that I wanted to do, and they liked what I was saying and doing. And so when I was graduating, they said, hire this woman. But they were working in Boston, and I was in Knoxville, Tennessee, and had never been to Boston. And so they gave me a phone interview and hired me on the spot. And I drove up to Boston, having never been here, with my U-Haul, which was entertaining when I got stuck in a little alleyway in my U-Haul. So that found me working at the National Center on Family Homelessness. And I worked there for a little over 3 years, doing a variety of evaluations. So I was a program evaluator for them, looking at different programs that were serving homeless families and trying to help them figure out, again, what's working, what's not, where are we finding out what really is helping these families and these children, and what is maybe just sort of maintaining status quo or even doing more harm than good. And so again, I was sort of trying to figure out for myself, is this making the impact that I want? Is this, is this doing what I want it to do? Or is, and seeing what's a good fit. You may find that you're going to find organizations that fit you, and you're going to find organizations that don't. You're going to find some organizations potentially that have outlived their mission, and some that don't. But again, you're going to meet people, and you're going to make contacts. And once again, in doing one of those evaluations, I was running a program there that was evaluating programs across the country that were trying to integrate primary care and mental health at healthcare for the homeless programs, and trying to see if we could do a better job of having mental health and primary care work together and not be two silos for every patient, right? Because those are things that are happening within a person and shouldn't be two different systems and two different sets of caregivers. And in doing that, and in visiting 14 different cities and talking to all these different caregivers, I met a lot of really good people. Happened to meet a really good team that was here in Boston, and really loved what I saw here, and ended up getting a job here. So was able to move without moving. So that's Boston Healthcare for the Homeless program. I've been here at that organization for a little over 17 years now. So it's a long way of getting there. But in that organization, I found the perfect blend of impacting the individual and changing the system. So it's an organization that I could see the impact on an individual level every day. I could see what we were doing, and that we were actually doing good work and helping people, right? And I could also see that so Boston Healthcare for the Homeless program is one of the first healthcare for the homeless programs in the country. So healthcare for the homeless as an idea came about in 1985. And it was sort of this test pilot program that came about and there were 19 cities that tried it out, and Boston was one of them. So this program is one of those. And it is now still the largest in the country. So, and it is still looked to as a model. It continues to be, as one of the oldest and the largest. It is also incredibly innovative in what it does and how comprehensive it is with the services it provides. And so what it does sort of locally, but also nationally, changes healthcare systems and changes minds and changes approaches in healthcare, in policy, around homelessness, around Medicaid, around Medicare, around housing. So, you know, I'm seeing what we're doing, again, on an individual level. I'm seeing us literally save lives, but I'm also seeing us change minds and change policy. And so for me, that's what made me be able to stay here for almost 2 decades. The other piece of that is that, you know, in social justice work, we'll never run out of work to do. Good or bad, we'll never run out of work to do. There's always going to be something that's going to need doing. And the beauty of a place like healthcare, like Boston Healthcare for the Homeless program, is that even within that organization, I'm able to reinvent myself. So every few years, as the world changes, as the needs change, I'm able to say, look, this is what's going on, and I see this need, and like, who's doing this, and could I maybe do this? I feel like we need to shift. And so I've had a number of jobs, and I tweak or write a new job description and say, shouldn't we have somebody doing this? And don't I seem like the great candidate for this? And they, you know, so we've just sort of created new jobs and roles as we see it. And I think, you know, looking at Rob's job, you know, resume too, I mean, I think you'll see, like, you kind of reinvent yourself, which is a nice thing to know, because sometimes I think you feel like, when I look back and think about how I felt in my teens and 20s, you felt like you had to know what you were going to do for your life. But you reinvent yourself all the time. And like, not only can you, but you should, because like the world keeps changing, and that's part of growth. And you can do that whether that's totally changing paths and careers, or you can do that within one path and career. And I've done both. Like, I've jumped around jobs, and I've jumped around sort of within this one organization, and continued to sort of reinvent myself. I know I've kind of gone a little long. I have other stuff sort of on the side that I'd love to talk about too, but I don't want to take over Rob's time. So, Kirk, should I?
That's a good stopping point. Thank you. That's good information. But we'll get back to more with questions and whatnot. Thank you, Joslyn.
Okay, are we ready to go?
Yep.
All right. Hi, everybody. My name's Rob Nash. And before we get started, I don't want to embarrass her, but a special shout out to my niece, Sarah Matthews. It's always good to see you. And Sarah and her other 2 daughters are, in my heart at least, family to me. And so it's always great to see them. And it's great to see all of you. I really appreciate you taking the time to listen to what Joslyn has to say. And we'll see how many of you fall off as I drone on. But I'm a little bit more of a vintage graduate. I'm the class of 1983. And the first thing I want to say about commonalities with Joslyn is I think it's really super key to point out that we were both religious studies majors. It was Eric Mount, Scarb, and Tom McCullough were my guiding lights. And what really helped me as far as my intellectual development goes was exposure to liberation theology. And I still carry that very, very close in my heart. And for those of you who aren't aware, don't want to give a whole lecture on it, but just real briefly, in a nutshell, the idea is that God has a special place in her heart for the poor. And I happen to embrace that very, very fully. And I got exposed to that at Center. I also got, fortunately, at Center, the tools that allowed me to reinvent myself. I was probably Joslyn's age now, in my early 40s, when I decided to leave a career in IT and go to school to become a nurse. And when people ask me why I did such a crazy thing, I always say that my heart and my hands just weren't connected. That, I was working in healthcare in a corporate setting in an IT consulting position. And I thought when I entered into that environment that I was going to be helping people because I was working in healthcare. Well, working in healthcare in IT for a private hospital corporation has little or nothing to do with helping people, I learned. And that's where I also learned the lesson that it is possible, but not pleasant, to find yourself in a job situation where you're successful, but you're not satisfied. And the key is to find both. So thanks to a very, very supportive wife and two amazing boys, I was allowed to go back to nursing school. Vanderbilt has a really cool program that takes people like you guys who wouldn't have a nursing undergraduate degree and put them through a very intensive 2-year process and crank you out as a nurse practitioner. So I went through that process in my early 40s, and I did that because I wanted to find an underserved population that I could roll up my sleeves and get to work with. And the first population that I found, and one that's still very near and dear to my heart, was Nashville's homeless population. And I took a job at a shelter that's now called Room in the Inn. It's Nashville's second largest homeless shelter. The largest shelter here in Nashville houses, I think, between 500 and 600 men a night. And there's a separate shelter that's run by the same organization for women. Family homelessness is an addressed challenge here in Nashville. What was I going to say about that? Oh, yeah. And then Room in the Inn, as the second largest shelter program, was a lot more like what's probably akin to what's going on in Boston in terms of not being just a bed and a sandwich, but actually providing support services and case management and training programs and other resources for people who are experiencing homelessness to try and break that cycle. So I spent 1.5 years there, and one of the things that I'm most proud of that happened during my tenure there, while I ran a program that's called Medical Respite, and Joslyn will know what this is, but what this means is medical respite means a place for people who are experiencing homelessness to go and recover after a hospital visit, because hopefully none of you know this because you're all young and healthy, but when you go to the hospital these days, you don't get to stay until you're ready to go back to work. You get to stay until the insurance company says it's time for you to go. And that's the assumption that's baked into that, is that you'll go home and lay on your sofa for a week or two with a refrigerator full of food and everything you need, and clean clothes and a shower, and you'll recover and you finish your recovery, and then you can go back to work. Well, people who experience homelessness don't have that luxury. And our program, which was the only one in Nashville at the time, and unfortunately no longer exists, gave those people an opportunity to rest and recover from significant injuries and illnesses before they had to go back to living under a bridge. And that's a pretty hard thing to say, but at least we're able to give them that. And one of the programs that I developed when I was there that I think really reflects what I learned at Center very well was a program called the Foot Clinic. And what we did was, and what's still going on today, is once a week, 12 people have the opportunity to go to a central location and just sit and have their feet washed. And experience, like Joslyn was talking about with the goat thing in Louisville, is experience the idea of just being touched, of just being acknowledged as a person, not being objectified as some gross, nasty thing that nobody wants to be around, but just honored as a person. And I felt like foot clinic was a really nice coming together of both the religious aspects of touch and also the clinical aspects of touch, because I won't bore you with it, but you can learn a tremendous amount about a person's health by looking at their feet. So, not only could we assess other risk factors and assess other disease processes and send them to a clinic for care, we could provide that human touch. We could cut nails that were so long that, they were curled back under feet. And you can imagine, walking all over Nashville all day long to different churches to get meals in shoes that are 2 sizes too small, that were used and beat up when you got them, and your toenails are so long they're curled under your toes. So that's the reality of homelessness in Nashville. So we were able to address that with that program. And I feel like I owe Center a big debt for being able to conceptualize something like that. I am working now. I did that for about 1.5 years, and then I had the opportunity to join the HIV clinic at Vanderbilt, which is the largest HIV clinic in the South and one of the 4 largest in the country, both in terms of the number of patients we take care of and then the quality of our outcomes. I've been here 11 years now. And I chose HIV because, even more so than homelessness, HIV is the locus of a lot of structural problems in our society. And people who are experiencing HIV or dealing with HIV, even in 2020, are very sadly still dealing with a lot of structural and social issues that were problems in 1990 and 2000. And it's really shameful and distressing. So I felt like it was a good place to lean into. So I designed a program about 4 years ago called Pathways. And what we do, and it's probably not unique in healthcare, but it's unique in HIV care, is I run a service that does not separate people like Joslyn was talking about. People aren't separated into a bucket called mental health and a bucket called clinical care. It's unfortunate, but those 2 disciplines don't share information with each other very well at all. So when you go see your doctor and talk about something, that's kept between you and your doctor. And when you go see a psychiatrist, that's kept between you and your psychiatrist. What the problem is, those things, like Jocelyn alluded to, oftentimes directly interact with each other, and you can't separate them. So I designed a program where, instead of seeing me once every 6 months for 15 minutes for all your healthcare needs, which is the standard of care here, you see me once a month for an hour, and then you see a therapist twice a month for an hour, and then we have a case manager who works with the community to make sure you get all the resources you need. And then we have dedicated phone support and some other things too. And we're targeting people whose lives are so traumatized by anti-Blackness, by poverty, by poor education, by homophobia. All these things are big deals here in the South, very sadly still. And so our program tries to help people take better care of themselves. And one of the guiding lights when I put this program together is sort of different from Joslyn's perspective, is I felt like I couldn't change the world. I felt like if I could write a prescription for poverty, I would do it. I feel like here in the South, the challenges are so great, and the odds are so stacked, and the environment so hostile that I can bang my head against the wall trying to fix that. Or I can identify people who need special help and try to give them the tools that they need through a combination of behavioral health care and clinical care and case management to better advocate for themselves in an environment that's toxic. So it's much more focused on the individual, but again, the creativity and the idea that could happen comes out of that center college education. We also have some data analysis tools that we use that I put together that are unique across the country to help identify the strengths of people so we can build on those strengths, because not a lot of programs are strengths based. A lot of times you can go to the doctor, it's don't do this, don't do that. But for people who have nothing and people who've been traumatized, it's super important to focus on the positive things in their life. So that's me in a nutshell. A couple of career observations I would make, and I tell this to people all the time at Vanderbilt, is no one discipline owns structural problems. You know, structural problems in our society cannot only be solved by social workers or nurse practitioners or economists or lawyers or English professors or anybody else. We all have a place at the table. So I think that, you know, you can find a way to make a contribution regardless of where you find yourself professionally. And in fact, I really long for and really enjoy those interactive cross-pollination conversations, because they tend to get at the most creative solutions sometimes, rather than just looking to see what have your peers done for the last 20 years and why not just keep doing that. So I'm a big fan of that, and I really do truly believe that everybody has a stake in all these issues. I also think that it is, let's look at my notes here. I think it's super important, like Joslyn said, this is the last thing I'll say, super important to build a network. You know, a career in social justice, it really struck me when I was listening to Joslyn speak. It's very unlike a career of a person who decides they want to be an attorney or an accountant, and they go to work in a firm and they stay in that one firm their entire career, and they just go up and up and up and up and up in the same firm. I think if you're looking for a career in social justice, it's kind of almost the exact opposite, is that you'll end up hopscotching and reinventing and looking at yourself in different ways. So it's super important that you find allies, even if you don't feel like it's a connection that you can benefit from. Still might be a super important connection a few years down the road. I'm a big believer in the philosophy of going through doors that are opened for you. And when life opens a door, I think you go through it. Even if you don't know where it's going to lead you, I think you go through the doors that are opened for you. And the last thing I'll say is, well, the last thing I'll say is that it's super important to have an ally in this work. This is not work that you do by yourself. This is very, very wearing work on your heart. It's very wearing work on your spirit. In the current political climate, it's extra difficult to do this work. It's hard to do this work when you don't get to see the success you wish you could all the time, because I can't fix chronic homelessness. You know, there are, the last time I got data on this, there were in excess of 20,000 public housing vouchers that were floating around in the city that there were not places to use. So people end up being on the street for 5, 10, 15 years waiting for housing, because housing is not being built, and housing is not even required to be built in some places. So, you know, you're not going to get that home run every single time, but you have to find it in your heart to believe that getting up and trying is worth it. And so that's why I feel very strongly you have to have a really core group of allies. And I have found that always to be something that I got the most out of when it wasn't my spouse, because it's easier, and this is something I had to learn over time, but it's easier to have a conversation with somebody when you're just at the end of your rope, when they know everything that you're talking about, and you don't have to explain why you're at the end of your rope. You can just say, I have had it, and they get it because they're in the same battle that you are, versus going home and saying, I've had it. Why have you had it? Well, I've had it because Mr. Smith couldn't get his prescriptions. Well, doesn't he have insurance? Yes, but, and then you go into this 20-minute conversation about trying to explain the background, and by then you're frustrated that nobody gets it. So have allies, find allies in the work that can help support you while you do the work. So I hope that's helpful, and I really appreciate all y'all being here.
Well, thank you both for that information, both personal and very good insight. So I appreciate that. Students, this is your chance to ask them questions. Please don't be shy. But do remember, you have to unmute yourself if you are going to ask a question. So who wants to kick it off with questions? always that first person. No questions?
I can start. So I know, is it Robertson?
Rob.
Rob, okay. I know Rob touched a little bit on this, and I myself kind of struggle with this a lot. Compassion fatigue. I know you gave us like really, really good like tips on like having allies and focusing on like the individual instead of like getting overwhelmed with like the bigger umbrella. But if you guys can tell us any more tips to kind of like cope with compassion fatigue, that'd be really great. Thank you.
So for me, I mean, it's real. So personally, you know, I suffer from anxiety and depression, not unusual in this work. Big things, I mean, I think Rob touched on it, you know, finding people plural, and people in your community. So one of the things that has really been helpful for me, so, you know, I live in Massachusetts, which has been great. So you know, my whole life until I moved to Boston, I was in the South, which, you know, as you guys know, the struggles are different, but the struggles are real in terms of the social justice issues. But that doesn't, but Boston has its own set of challenges as well. And I'm now in an area north of Boston that has quite a lot of, it's going through its own serious racial justice issues. And so really in the last 5 years, I've spent a lot of time really getting involved in the community and making sure that I have a tight group of community allies that I can turn to. So again, like we can just sound off and really connect and also pass back and forth and say like, I can feel like I can make a difference, which sometimes is the thing you need, is to be able to step in and do something. And sometimes you also need to be able to say, my tank is empty and I need to tap out, and to be able to have that balance, right? Because sometimes the thing you most need is to see that you've made a difference. And sometimes what you most need is to curl up in a ball. And you have to be able to do both, I think, in order to keep going, right? Because otherwise you're going to either burn out or do nothing. And I think neither one of those are tenable for any of us. And so I've been, you know, really involved in the community, so that I've been, you know, I'm on boards with local campaigns. I'm on the board of several state reps. But that allows me to also I've been involved in a lot of the Black Lives Matter movements. And so now, like, when things got hairy, I served as the white ally at several of the Black Lives Matter protests throughout the Merrimack Valley. And what I was able to do is that when I saw things that were worrisome, or when I saw police overreacting to things, I was able to call a state rep who's now my friend and who I'm now their advisor, and say, like, can you call chief of police and tell him to knock it off? Like, and, you know, stand down. There are 25 kids here and 50 guys in riot gear. So, but having that core of community activists and sort of fellows in arms really makes a difference, right? Without that, I felt so sort of, like Rob said, like you're beating your head against the wall and you're kind of alone in it, and you feel like you're going to just run out of energy and you're up against nothing. So I think having that, making sure you find those people who understand it, and you don't have to explain the issue, you don't have to explain the frustration. But then they know they can call on you and they can say, like, is anybody available to do this? But also, like, look, I'm at my capacity. Can somebody accompany this kid to the police station? I can't do it. So having that blend of, like, knowing you've got your people.
So something else that really helps me, I really appreciate this question, and I should have mentioned it in my comments, but for me, self-care revolves around picking very carefully and very intentionally my hobbies. And I'm an extremely introverted person, so When I come home from caring for other people all day long, I just want to be quiet. I don't want to engage. I don't want to talk. And so I have two hobbies, and doesn't matter what they are, but one of them is music. I play a little guitar, jazz guitar, and the other is weightlifting. And the thing about those that I really like is they're both areas of my life where I can push myself as hard as I want, and nobody can tell me I can't do it. And I can measure success and define success on my own terms. And I don't have to, be told I can't do this because the insurance company says I can't, or because Vanderbilt says I can't, or because the world says I can't. And so I have found for myself a couple of outlets that allow me to feel that success. And and also, just in terms of dealing with mental health, the weightlifting is great because it's nice sometimes to get up in the morning and be so exhausted when you get to work that you don't have the energy to get exhausted at work. And so, believe it or not, sometimes that makes a benefit too. It certainly helps with the mental health to have something physical to do to push yourself. So those are big things too. So I'm always encouraging people to find a hobby and find something you can really bury yourself in and go at that as hard as you go at your professional life.
Next question. Come on, be brave.
I'll jump in with the question. And this might be too pointed, so let me know. But Joslyn, I really appreciated your discussion of like going to get your master's kind of right away. And as I'm graduating in May, long term, my goals have just been to get my MSW, and that's been my plan forever. And now I'm kind of processing what that's going to look like, what a gap year or two is going to look like. Do you have any suggestions of where to look for jobs or internships, what types of things to look for that are going to serve me, as I still plan to get an MSW at some point? But does that look like working at an entry-level job? Does it look like working for a nonprofit? I don't know.
Well, I think first, it's knowing if there's a specific affinity or issue that you're interested in, right? Is, within an MSW, do you have a particular issue that calls to you, right? Is it mental health specifically? Is it poverty? Is it a disease group? Is it a certain population? Is it immigrants? Is it, thinking about like what calls to you within the MSW? Is it policy broadly? Is it, thinking about sort of what calls you to an MSW, and then go from there, right? So it's thinking about what is it about the MSW that resonates with you? That will help you then think about like, is it, and then I think finding that area. So for me, like for a long time, I was thinking about like, maybe I want to go to DC and look at like, working an internship or a low paid position as like, in different kind of policy think tanks. Maybe it's thinking, because maybe that was where I needed to make the change. And obviously that's not where I ended up, but like, so it's thinking about like, what is the part of the MSW that is calling to you, and is it broadly like what the MSW means to you, and then, or is it a particular issue or set of issues, right? Is it like a population group or an issue area that calls to you? And then I think, I think you find organizations that serve that, right? That focus in on that area. And then if you can, if your life, financial and family and everything else allows you, you free yourself to go where those organizations are working. But that's a big if, especially in this world. But like, as much as you can, you free yourself to be able to go where that takes you. And try to, and also be ready to see when you've done that, to say like, this isn't quite it, and then pivot. but it also, you know, like the freedom of that gap year or 2 or 3 gives you a chance to pivot, and you haven't locked yourself into something. And then you can say like, okay, so this is sort of gets part of it, but then I know as I'm doing this and I'm reading and learning and listening to podcasts and hearing these other things, you know what else? This actually like excites me more, or this resonates more, or this feels like this is more important to me now, and I want to work in this other area. And I think like, to me, like I'm a book nerd. I've always been a book nerd. So like it's reading those things, right? Like that's going to help you too, right? Reading in areas, fiction and nonfiction. It's reading in those areas that overlap, that are going to, like, those stories are going to help you know where you want to be, where your heart is. Listening to podcasts that sort of, that, you know, that speak to the moment, but that are illuminating some of the things that are going on in the world, that'll help you too, right? You're going to start to feel like what gets you excited, what keeps you up at night, what starts to make you